Hello and welcome back. Today we're very lucky to be joined by Meng, CEO of Stellar Health. Thank you for joining us, Mike.
Yeah, thanks for having me.
Thanks, Mike. So first question for you is, what was your first ever job? Because your fund's often a good story behind it or something you might have learnt. So we'll start there.
Yeah, so growing up, I was probably did odd jobs in entrepreneurial thing, but so I didn't really have a real job until my junior year college internship, in which I got an offer at UBS Investment Bank.
Oh, wow.
It was kind of unique as they were like, you speak Chinese Mandarin. Would you like to go to Hong Kong instead? So it's all right. I went to the Hong Kong office, which was a really cool experience, actually, to be still in university and spend a whole summer there. Had a lot of great friends I made there, and it was UBS Hong Kong at a time when things were really flying off the shelf, but it was still very I'd say more Wild West than it is today. So
yeah, was that like around 2006, around that sort of time?
2005.
2005, yeah. Would have been an interesting time to be in financial markets in Hong Kong.
Yeah. No, there would have been plenty going on. I think one of the guests we had on a little while, just recently, they also did a similar thing where they sort of got, jettisoned over to Hong Kong and sort of, they said the collegiate sort of mentality, everyone was sort of there to work but had a lot of fun at the same time.
Yeah, I would say the whole 996 or whatever is very real in China. Like people work very hard there.
Yeah.
But what's kind of neat was people were still figuring it all out at the time. Years later, I went back and, it's like a much more, developed, let's call it financial system at this point. So at the time, it was really we don't even know what's normal for what's in the prospectus we're writing, right? So you're still kind of figuring some of those things out at the time.
Oh, it would have been an awesome place to sort of cut your teeth. And then I guess that investment banking career, obviously, it's probably not unreasonable to see the link to how you sort of ended up, working at Lazard early on in your career. What were those initial couple of years like, sort of in the thick of things? Was that back in the US or where was,
Yeah, I think ultimately I grew up in the US in Michigan. And so part of it was, I do think kind of going to maybe the leading financial center that I could think of, which is New York nearby.
Yeah.
Not being so far from home. Was fortunate enough to have an offer at Lazard and got picked into the healthcare group. That's actually where my healthcare background comes from, is ever since then, and I'll be honest, I did not necessarily want to go into the healthcare group. You all probably understand when you join these professional firms, they kind of match you into it. And
you pull and yeah.
I would say it was my third choice, not my top choice by any means. Yeah. But after I fell into the group, I fell in love with it. So that's actually, stuck with healthcare ever since then. So it was very fortuitous and just very fortunate that it happened that way. I, like probably many of you, did investment banking because it was just the fastest way to learn as much as possible. Did I recognize it would be really hard work? Absolutely. But I think you just gain so much knowledge in a very short amount of time. And that's why I did it. I was also fortunate, some of my best friends went to the same firm as me. So I listened to a lot of people that we knew. We're all still actually very good, close friends and as still to this day. My brother actually followed suit as well at Lazard. So just a lot of people have gone through there and think back to it very fondly.
Oh, fantastic. No, I think that whole journey is pretty much where Will's going at the moment.
Doing the same sort of thing.
Yeah.
Very different in Australia, though. We don't have siloed groups as such because the market's just a bit smaller, so we don't have our own healthcare sector. So you do see a bit more, broader things in different industry groups, which is probably a good and bad thing because you're probably on less deals. But yeah, no, it's interesting how you were just lobbed into healthcare and you've sort of stayed there your whole career.
Yeah, after not necessarily wanting to get there initially. I think that's probably the biggest learning lesson.
Well, the fun fact is I wanted to be a generalist. That was actually the top choice. For exactly the reasons you just stated, to actually keep options open. And I ended up in probably one of the most specific esoteric industries. But again, haven't looked back because of that.
Yeah. And then so your time at then Apex post that, obviously was that in healthcare again as well, and you were sort of managing those sorts of investments?
And just for our listeners, Apex probably more on the buy side, private equity style of role. So yeah.
Yeah, I don't know how well developed it is in Australia as well, but the recruiting system and program out of banking is very solid here. So within a year of you being an analyst for the first time, you actually get recruited to join your next job already. So about a year in advance or more where exactly you're going. And you have to make this whole other life decision pretty quickly. I was fortunate enough to land at Apex, which has just really great culture, and ended up there. It's a global firm, large firm as a whole. And yeah, you get, at first I'd say they kind of let you pick a little bit more. Over time, it became much more specialized, but I did want to do more and more healthcare stuff. There were times where we worked on other industries as well, but really, really enjoyed it. And again, increasingly wanted to specialize into healthcare.
No, absolutely. And within sort of that Apex group, you know, you deployed, I think I read somewhere nearly over $3 billion in funds. Yeah. Can you talk us through sort of like, because it is a slightly different skill set or quite different skill set to banking, where you're trying to drum up transactions and, you know, whereas on the buy side, I imagine you're probably saying no a lot. Can you talk us through? Yeah.
Sure. Well, you hit the nail on the head that the sell side is very much that. It's you're trying to drum up the transaction, right? I used to be like a person who nerded out and read all the books on investment banking as well. And, you know, one of the Bruce Wasserstein was the leader at Lazard at the time. And one of his, you know, nicknames was Bid 'em Up Bruce, because he would drum up more people to want to bid up something, right? And I think that it's very different on the buy side. That being said, I think as private equity transformed, there was a really big part of the job that was still selling yourself. Part that you're selling yourself is to the trust of the management teams, right? So you do have to be someone that people want to partner with and work with, but you don't have to sell the transaction or the deal. You're selling like, are you someone they want to partner with on their board, et cetera? So that part is still very real. I think it's actually one of the hardest parts of the job in private equity, which is a little bit different than, say, public market investing, is that after you kind of really learn a lot about a company, go deep, and you really, really enjoy it, you actually have to step back and be super independent in thinking and say, intellectually honest, what do I really think of this? And do we want to make this the 1 or 2 deals we actually deploy in this year? And that's what makes it, I think, particularly challenging.
Yeah, interesting. And we'll touch base again and probably circle back on this theme a little bit later as it relates to being the founder and choosing your capital partners. Yeah, no, that insight around just selectivity and separating qualitative and quantitative sort of processes that you go through, I reckon it'd be a test of temperament, that's for sure. Yeah,
it's very different, obviously, because in public markets you can get out the next day if you want something's changed. But obviously, if you make an investment in something that's private, you're in for the long run. So yeah, it's
well, and you're a little bit removed, right? So meaning you don't have this stronger or deeper relationship that's developed with any of the management team. Like you don't spend time really going through the business. So you're kind of reading things from a public market lens.
Yeah.
And I think that again makes it's a good in that it leaves a little bit more objectivity there.
Yeah.
And you have to think about it a little deeper when you get into in the private side.
Public market investors just probably fall in love with Bloomberg and those sorts of things more than the companies.
Yeah. All the above.
Yeah, no, interesting. And so like I think one of the cool things that I really found when we're preparing for this podcast about you, Mike, is even in that role where you're deploying, you know, billions in funds and I'm sure you got pressures everywhere, you still maintain that curiosity. And in that sort of very much led to what you do today. And one story I think you shared in a post you wrote late last year was around, you know, one of your friends left McKinsey, being the global consulting firm that most people on a podcast probably know, to go work in a space that really intrigued you. Do you mind sharing sort of that story with us? And yeah,
I think a big piece of this is that I think as an investor, you again sit a little bit removed from actually trying to change the world, right? You're a little bit at a spot where you're investing behind the company or the people that go and do that. And I'd say there was always a bit of a calling to want to go do that more directly, to build something and do so. And so when the call came from my classmate, schoolmate, you know, I was like, yeah, this makes a lot of sense. Interestingly, I had a couple different other offers at the time. One for a really big healthcare institution in the US, really well-known name. Another for another really big private equity fund. And I actually turned both those things down. The more obvious choices I turned down to go down this path of completely not knowing what the world would entail. And I remember those first couple of days with my co-founder, Ben, and Ari. I was going to the NYU library and working out of the stacks there. I didn't have an office, right? I just had my first daughter or my first child. So it was kind of like a weird, almost like who would ever do that in this moment kind of situation. But you know, you sometimes just chase after it.
Is it and like there's not much more to it other than it just felt right? Is that sort of the genesis? Or?
I would say one really important thing, and I would encourage all your listeners as they think about maybe investing or starting a company or building a company, would be that you should put the investor lens on it though. So what I did do, and I didn't come up with our idea, just to be very clear. Some of my co-founders did, is that I actually ran it through an entire investment thesis deck. Thesis, risks. I really thought about, is this the right thing to bet on with my time?
Yeah.
And, you know, it passed all those different tests for me because That's where the truth is there isn't this like founder power sometimes. It actually is more that the business itself might be that compelling and interesting that you can then recruit other people to it. It can raise the capital, meaning it really has this impact out in the real world, and that's what matters. So why I say that is I did believe in very much the concept and what it would do and the efficacy, right? And the efficacy was there, and that's what leads to all these other downstream impacts.
Fascinating.
Yeah, what a crazy time to make that leap too. And you got, 2 or 3 really stable job offers. You just had a child, and you still go with this one. I think it's pretty cool story. Just for our listeners, do you want to give a quick snapshot on what Stellar Health is and what they do?
Yeah, what that compelling opportunity that you saw was.
Yeah, and then to maybe just slightly contextualize it too, maybe a little bit about the US healthcare system, because it's, I guess, unique to Australia in a way.
Yeah. I might say that the US is the unique one probably in the world. Fortunate in my time at Apex, I actually studied and looked at a lot of other healthcare systems around the world. Ours is probably the most unique, free market and broken one out there. You all probably have seen some of the statistics, but we spend over $4 trillion a year on it. It is growing from 10%, years back of GDP to today, 25%. I really worry genuinely that healthcare in the US is going to swallow the entire economy, which is not a good thing, because at that point it's so inefficient that you're just paying all your dollars away to keep up this benefit for your citizens, right? So we have to do something about it sooner or later. But yeah, it's a system where, because of all the different incentives, they're somewhat misaligned. You guys might be aware that in the US, you get paid on something called fee for service or volume. So the more volume you drive up in terms of surgeries or visits, the more you actually get paid. Now that is obviously the opposite incentive of maybe keeping people healthy. So that's where this concept of value-based care came from. And it's a great concept. Actually, I'd say pretty bought into in the entire industry, that we probably need to change the incentive mechanisms overall such that we're incentivized to keep you healthy rather than sick or make money when you're sick. So that part has actually happened. The problem is that in value-based care, the contracts are such where you actually have to manage a whole population. So that means you have to be a fairly large group of doctors in the first place. They also have to do all the right things to take care of their patients, and then hope that in 12, 24 months after the fact, there's some big reconciliation and they get all this extra money for having kept you healthy.
Yeah.
Great concept. But imagine you're one of those doctors and it's like, so I have to do all this extra work. I don't get paid for a while. So imagine if I told you, you're going to do all this work, no base salary. You're just going to do it all. And next year, I'll give you a big bonus, though, if you did all of them. And that's what we've done for a lot of our doctors. So to change that, and I think that, again, the concept are all right, and the contracts are actually kind of structured that way. But that last mile of delivery, how do you get that doctor and compel them to want to practice this way?
Yeah.
That's the real challenge. If we're going to make this happen in this country, we have to convert the 300,000 primary care doctors to practice in this fashion rather than just structuring some neat contract and hoping that they follow through on it. So that's exactly what Stellar chose to address, which is point of care software integrated today with certainly more and more technology from AI and other things that are moving things really fast. That in itself is great, but not the only piece. What's really even more important is that we align incentives at a granular level. So we pay you to do all the right things, the next best action for that patient. So if you come in and we actually give you insights that are, you actually need, colorectal cancer screening. You might have diabetes medication that's outstanding. And let's get you one more screening, and just in case as well. Those are the right things to do. Not only are we serving them up to the doctor to do, but we're actually paying them an incentive right away for doing those things. By doing that, we're translating into near-term feedback loops, and now they're starting to pick up on it, and that leads to the overall achievement in value-based care.
Yeah, wow. No, that's fascinating. And I imagine there's a nexus sort of, between a fair few different stakeholders, with all sorts of alignment being, the primary ones being patient and physician, but then by extension, probably the insurance groups, government, all those sorts of things. I imagine being probably a bit of a journey, getting everyone around the table. Yeah, can you maybe shed some light on that part?
Yeah, so, again, the U.S. healthcare system may be the most enterprise of enterprises out there. And what I mean by that is, I remember some of our early investors were like, so let me get this straight, Mike. You're going to pull together health insurance companies in the U.S. and doctors to work together and then you're going to get them to pay each other. They're going to get that one to pay the other to do this. And, these are big insurers that do not move the fastest.
Yeah.
You got doctors who are pretty resistant to change.
Yep.
And so I would say, yeah, we probably chose about as enterprise of an end market as one could have. Now, that being said, it's worthwhile, right? Because again, we have to change the system and we have to go after it. So we're really proud. Today, we have actually the major national insurance carriers. We have over 20,000 doctors using Stellar in 30 states. So it kind of creates a little bit of that flywheel that's really important, that the two actually do work together. We've actually thrown some summits here at Stellar, I would call out, where a lot of times the relationship between the two are quite contentious, the doctors and the insurance carriers. And we've actually had summits where we actually got them in the same room and we realized they actually see eye to eye on some of this stuff, but someone has to help enable them to both succeed in this. And that's, again, the role we try and play here.
Yeah, that's so fascinating.
Yeah, and then sorry, yeah, you go.
Oh, I was just going to say, Will, before the podcast, you raised that question around, like, from a lot of the things you've seen in the healthcare space around adoption. And like one of the biggest challenges in healthcare is adoption, because as you say, physicians have a way of doing things that have worked. So getting that take up, I think you mentioned, was it 20,000 doctors
yeah.
and now on the platform, and then pretty much all the big insurers. Yeah. How'd you go about that?
Yeah, I think two things I would point to is, number one, doctors do want to do the right thing whenever they can. You just got to make it particularly easy for them. And then I also, again, I will go back to humans, and the US system is a game of incentives, right? And if you have the right incentive there, they want to do the right thing and they will naturally be inclined to do so. I do think it's also important to really think a lot about what is their workflow. So one of the things we at Stellar pride ourselves on is really thinking about that doctor or provider workflow. How do they actually go about carrying out their day, and how can we make that particularly easy while it's rewarding as well? So both those things are really important pieces that we keep front and center no matter what.
Yeah, remove the barriers. Yeah, it's smart. Do you want to go back to, because you were very clear before in saying that this wasn't your idea, but you're obviously brought on board to help run it. What do you think that your other co-founders saw in you that they entrusted you with that? Because that's a pretty cool thing to get that call, and those people are trusting you to run their thing.
Yeah, I mean, I would say whenever a group is starting out, and at least for us this was true, we're more like a band or team of people. Like there was no you're the CEO, you're not the CEO. In fact, I was not the first CEO at Stellar.
Yeah.
And I'm totally fine with that. And I think that we really just want to work hard at it and really get it lifted off the ground. Again, they actually were more experts, my co-founders, in how exactly you go about serving up which actions, how do you go about rewarding for them, et cetera. I picked that up as I went. And I would say that a lot of this we knew sooner or later we would have to bring some more business professionalism to it, raise some institutional money, and also drive some more larger scaling and systems to this idea as a whole. The idea was actually born out of watching more mom and pop doctors out there. So it's kind of interesting. We knew we needed to go a little bit upstream of that and a little bit, again, wider. So again, it's one thing to do it. And this is what the US healthcare system would tell you is there's a bunch of pockets where maybe this has been successful, but it's one-off, versus across the board in the entire country, we're actually changing it regularly.
Yeah, no, that's super fascinating. And I think the ability to change things at scale, and I think you touched on sort of you do need some capital to do that. And it's something that I think ultimately most founding teams probably go through at some stage, is the considering raising third-party money, and then how that works, who you raise from. In your case, sort of how did you guys think about, I think your Series A round was around, or it was over 10 mil. Can you maybe give our listeners a bit of an insight into why you raised that amount, and then also why'd you raise from the people you did?
Sure. So I think one big piece of it is you should always map out what you need the capital for first. And I'd say sometimes in boom days that discipline goes out the window.
Yeah.
At least at the time, the 10 million, it was very clear what we were trying to scale. We had won and sold a couple big customers. We needed to deploy against them and deliver.
Yeah.
Right. So it was pretty clear what the 10 million would go for. We ultimately chose 0.72, and a really big part of it is the partners that existed there. It is a still people and human and relationship business to this day. The person who represents from there is on our board and very active, and we really appreciate that. And is someone who provides really great guidance, thought partnership, strategic thinking into the situation. And so I'd say that's a really big part of it, and really glad that we went the way we did. We actually did have a couple different offers, and we chose, this more for fit and relationship than anything else.
Like it comes back to that, when you're at your Apex days, selling yourself to the management team, and
They have to sell to you.
they have to sell to you.
Yeah.
There you go.
It's interesting, yeah. And then also, because obviously Stellar Health's like a tech-enabled business, right? Like you need to build that big back end and have that working, very well, because as you sort of say, you want to remove the barriers for these doctors to actually use the platform.
Particularly in healthcare.
Yeah, exactly, yeah. It seems like from an outsider, if I was to go start a similar business, it'd be so hard to build out that tech backing, especially probably the time when you did it, perhaps before AI was such a big thing. How'd you guys go about that? And then sort of what advice would you give to maybe a startup founder these days looking to do a similar thing? Yeah.
Yeah. So first had to find a tech co-founder, and thank goodness we found Octavian Kostash, our technical co-founder. He was an ex-Google person who built a lot of actually things in Google Maps, finance.
Oh, cool.
So
Yeah.
really star player. Joined our team very early on and built V1 of the app, I think within 30 days. No, I think, and I have to give him a lot of credit. Certainly we've had really solid tech and foundational, like for example, to this day, we still document everything internally, which is a practice he started. So very disciplined in how we do it. I think one of the biggest challenge I would tell people is, so number one, you need really good talent. You got to find someone who can do it, and they can have to be able to build out a team that can then go build it. But I think the really big challenge I would call out is more the nuance between going for MVP and quickly getting something up that works, which is always something we would prioritize, certainly when we had live customers and we had to go live. But on the other hand, balance for scaling. Sometimes people use the term tech debt, right? I don't know if I love that term. It's more about the fact that you just have to balance this. Like, am I building this for a systematic, scalable future, or am I quickly getting this up and running? And maybe the way I wrote that structurally today is only for the near term, right? And that's always a balance in terms of near term versus longer term thinking as it relates to that.
So you're trying to find that balance between getting a product up and ready because you've already sort of started a sales cycle, getting people in the funnel. Yeah, okay, it's interesting because I feel like a lot of people would maybe prioritize more like, having like the perfect platform before they then go out. So it's interesting the sort of, I guess the speed you attacked it with is it's definitely a smart strategy too. Yeah.
And I'll go deeper into it. Like one specific example would be when you give the data, do you ingest all the fields or just the ones that actually power what you need to do? And you kind of make that decision, right? And maybe you even have a sense that some of those other fields are important later, but not now. So what's your decision on that, right? And how do you make that decision?
And then you just document it as you guys have done, and then you sort of just carry on. It's interesting.
And then you have to keep some of those in mind. And I think that's where I think of it as balance of far sight versus short sight is a really important piece of that.
Yeah, no, it's interesting. And in thinking about Stellar Health, like obviously as you guys have evolved and, you're now a business that's got pretty significant adoption and through time has identified things and logical adjacencies to your initial product. How do you think about bringing on those? Because often, you hear founders that get distracted potentially at the next shiny light. And so remaining sort of within, I'll mention his name, but Ant Liveris, so a good mentor of mine, he always mentions this concept of your license to operate. How do you guys make sure that your decisions have sort of remained within that?
Yeah, I'd say two things about that. First is that focus is incredibly important as a startup. Like I cannot emphasize it enough. It's the thing that will kill you. It's probably the thing that kills most companies ultimately. So first, have to really define what are you focused on and where do you stay? And that's a lesson we learned sometimes the hard way, which is as you go into the adjacencies, the question is like, how much can you really go into those adjacencies? And should you go into those adjacencies? Those end up being a bit distracting, by the way, to the rest of the team, right? And so how do you really do that in a thoughtful way? Is the adjacency one where it's only a few assumptions of leaps versus many assumptions of leaps, and make those in a very intelligent way as well? And there is something really important about sticking to the core and saying, this is what we're focused on. We spend a lot of time really thinking about that, I think, every year in terms of where are we staying focused, where are we going to go a little bit further adjacent and afield. Certainly as of late, we've seen a lot of AI-driven healthcare companies, different ways you can use it. And those are all really interesting. We do think that's really interesting. But do they fit within our portfolio in terms of what we're bringing to doctors? Is that the right type of stuff we should actually bring? Should we partner it or build it ourselves? Those are all the different questions. And again, how much can we handle distraction versus staying pretty focused on the core? So I think revisiting that all the time. We recently went through an entire exercise where, in terms of strategy, we think a lot about not only what our winning aspiration is, right? What are we trying to accomplish or go conquer? But also, more importantly, I think a big part of strategy is where to play and how to win. So you really got to stay focused on where you're going to play and how to win. And I'd say we've gotten more and more refined on that as of late. This is like the crossing the chasm type stuff. If you read it, like you kind of have to pick a beachhead market, really go take that market first, and then maybe move out from there, and to be really thoughtful about that as you plan it.
No, interesting. And like around when you mentioned sort of like we go through these exercises, like who are you looping in those discussions? Like, is it like I go on your website and like, you guys have a pretty wide network of people that are your feedback loops out in the community. Yeah, I'd love to hear sort of how you lean on them.
Yeah, first, we have a great board of advisors, so shout out to them. They have always been at they're there for us to call whenever we needed help, and they are a lot of the most experienced people in this industry, so absolutely them. Certainly, we do a lot of it in our senior leadership team here, so our C-suite, we get together quite often and talk about it. I think increasingly, the area I would emphasize is we're trying to really bring in that next level of leadership, so the extended leadership team, folks that are kind of in that director level, vice president level. We really want them involved as well in the decision making, and at least giving input into things they're seeing on the ground, and also how we would carry out and execute these things. So that's a really big emphasis, is to really increasingly incorporate them into this.
Yeah, interesting. And then just back on the whole idea around your core, and I guess your core was essentially trying to disrupt the undisruptable. Like, people never thought you could get the insurance people and the doctors in the same room together. In those early days,
digitally and physically.
Yeah, digitally and physically. But yeah, so in those early days, do you want to speak to any, might be a bad word, but like any doubts you had or anything, like, actually pulling it off? Because it does seem like such a hard task in this market from what, we've learned today speaking to you. Yeah.
Yeah, I would say hustle is absolutely a real thing. One interesting thing is that you're kind of, at some point, relationships and some of these networks matter, but it's still pretty hard to pull off. Like in a lot of our customer landscape, you have to get 5, 10, 15 different people and departments to sign off, right? Like ultimately, and that's not easy. It's not hard. It's very hard. And I think a big piece of it is probably adaptability. So all startup founders, I would tell you, you got to stay adaptable, figure out what is it that navigates you through that compliance issue, right? Not to skirt the compliance issue, but to actually navigate it with them. You guys probably follow, there was the whole Change breach in healthcare where, United Healthcare had to pay some big fines after a breach. That actually created a ton of extra work for us all of a sudden because they were trying to put more like administrative regulatory burden to check a bunch of boxes. And we certainly care about security, but you got to go about that the right way, I think, and think about those things. So, you really got to think about and learn on a constant basis, like what is it the customer needs you to do to navigate through that. And same with the doctor side for sure. All doctor groups are a bit different, and how do you navigate and fit what our product does for most of them as much as possible, and identify the ones where it really makes sense and it works for.
So in this sort of growth stage of company that you're now in with Stella, where you've got, you're talking about sort of the next level of management that can sort of come through and really setting them up for success. They're all sort of probably, in my head, the telltale signs of a business that's, really starting to move into being quite a well-established, well, you already are, but an even increasingly established institution. How do you sort of think about the medium to long term for Stella now? What are the key things that you guys have on the horizon?
Yeah, I think the really interesting thing is we continue to stay focused on a lot of our key markets. And in our key markets, you want to build out like density, both density in terms of the number of doctors that are in that market that are using you, but then also density of the number of patients within those doctors that you're helping and working. That creates a very natural flywheel. So that's something we're pretty focused on. We talk about it all the time in our strategy, and we're going to keep going on there. I think where I'm increasingly really interested is I do think technology is at a place where there's a lot of really neat things you can do to, again, add value to those doctors, whether you're making it easier and decreasing their burden, but or bringing even more dollars to the table. But in either case, I think there's a lot of opportunities that are getting opened up, especially when we think about the technology and product I think the really cool thing about technology product is that when you build some really useful, neat things, it sets a foundation or platform that you can build other new key things on. And that opens up more doors for ever more things. And I think that's really what people mean by the compounding of a business or technology, is that you actually open up more doors. I mean, take Uber, for example. Certainly there's Uber rides, but a clear door that it opened was Uber Eats, right? Like you can actually deliver food. Then at some point that actually opens up some other opportunity out there. So technology actually begets like more opportunities the more you do it and build a platform, solid platform on it. And that's kind of how we're thinking about it, is what are other more neat and great things? We have this distribution, right, with these doctors that trust us. What else can we be bringing to them now that is interesting? Of course, that still has to stay to the core in what we're trying to do.
Yeah.
But how do we make some of those decisions with really solid technology?
So still a pretty keen focus on research and development of you know, and building out that tech stack is still at the core of it. Yeah,
Absolutely.
Yeah, cool.
Yeah, I guess sort of around the discussion, Mike, we're keen to ask some more general and broad questions. Something that I sort of picked up upon throughout chatting with you today is you're obviously quite well read. So I mean, you said you even researched like all these different healthcare systems around the world, and so and then you sort of picked up on the fact that the US is like quite weird and different, and it's weird and different for XYZ reasons, and they can be disrupted. I think there's a lot to be gained from that. And I think perhaps people don't do as much of that sort of reading at like a real broad macro level, and then to identify problems that can be fixed in their own sort of local economy or in their skill set area. Do you want to speak to that and sort of what advice you would give to people, trying to find like a problem to solve as well?
Yeah. I mean, first, being well read is absolutely, I mean, I don't know a single successful person who does not read a lot. And I'm talking about long form books, not blog posts and short form content. And I'll admit, I was actually just talking to someone recently about this, but growing up, I was not a good reader. I actually probably didn't read most of the books that were required in class, and did not, and I passed all the tests, right, and whatnot somehow. But it wasn't until my 20s till I decided that I actually wanted to try and learn how to read and like really be good at it. And I kind of continue that process today. I think one trick is I read a nonfiction book and then a fiction book. So I have both things, and I alternate quite a bit on that. I think it's actually quite important. I think those are actually, they develop different parts of the thinking. I also think that continuously just trying to find interesting topics that don't necessarily even relate. So I can certainly go on a bunch of healthcare books. I could go down a bunch of business books, but I actually love reading history, for example. I love Da Vinci's the Da Vinci biography by Walter Isaacson, or the Steve Jobs one. Those are all great, right? But then also I'll read a bunch of sci-fi books that are maybe not the most advanced, but they're certainly entertaining. So I think just reading, broadly speaking, is super helpful. And maybe the thing I'll actually put a little emphasis on for all founders out there is actually probably writing. And this one worries me a little bit with the age of AI, which is, are you really learning how to write? And writing is so key as a way of communicating. So if you think about like good product or product requirements documentation, like what is it that you're trying to accomplish? Synthesize in writing. A lot of companies I sit on the board of, or a lot of people at Stellar will know, I'll be like, hey, can you put that in writing? Can you put that actually in a one pager or two pager? Because by synthesizing your thoughts, you actually get clarity of what is it that you're trying to actually solve for. You're trying to get to what is the real crux of the problem? How do you actually parse the problem into maybe 3 different problems are going on at the same time? So that clarity of mind is really key. And then it's also the medium that then allows you to communicate with one to many. So a conversation like this is great. I guess this will be a podcast, but if you're just having one conversation, that's one person, are there better ways to communicate one to many across the board?
No, really interesting take on the particularly I picked up a few almost learning how to think. It's like there's a family office in Australia that we do a bit of work with, and at the moment one of the key things they've seen in some research that's come out of a uni in the US is that in that uni, this study revealed that they're somewhat worried that in this increasingly technologically driven age, we might be losing some of our traditional ability to think. And like you even made the comment, learning to read, and it's like you could clearly read, like you're
to actually properly understand, read and think deeply about what you're reading.
It's funny when you say it to people, because I've spoken to a few people about sort of this whole concept of learning how to think, and there's a whole bunch of them that just sort of look at you and go, what is that airy fairy like rubbish? And like you can just tell that like the attention spans and the willingness to delve deep into problems without any immediate transactional gain, that's almost the competitive edge these days. Yeah.
I think that's right. When you write things down, you synthesize it into organization.
Yeah.
And so when you organize those thoughts, it's easier to then therefore maybe explain to someone else, right? Like if you think about like the orders of even math, like, addition, subtraction, going to the higher order of multiplication, division, and then multiplication, division going to exponential or cubic or powers, right? It's like that is organized in a specific way. And have you really thought about the fact that those are organized and are these higher orders of magnitude of math, right? And so organized thinking, I think, is a really important skill that, again, I worry a little bit that with AI, it just becomes something where you don't have to maybe necessarily practice that all the time. But if you're not organizing those thoughts in your own head, then you're not clear about it to maybe your whole team or your company, and then they're not clear on what exactly did you want in these situations. So again, I think it's a very, very important skill in terms of how do you communicate. And another big piece of is simplify, right? If you really master something and really understand it, you should be able to simplify it for someone to understand really easily. And that's another part of the writing skill that all good writers, I think, have. And I'm not saying I'm a good writer. I think good writers can translate something that's actually reasonably complex into something that's actually quite understandable.
No, that's fascinating insight.
Yeah, so I guess to round out the discussion, Mike, a question we'd like to ask all our guests is, what advice would you give to a 20-year-old version of yourself? So maybe the version of Mike that was going over to work in Hong Kong.
Yeah, I'll give two. One is an interesting exercise that I really did like, that one of my forum groups actually came up with, which is to sit down and write a note to yourself 25 years from now, and actually just pick a long dated year. So 25 was arbitrary, but
yeah,
pick 25, and it's like write everything about what your life looks like at that time. And we started talking about things like, wow, my daughter would be 30 years old at that time. She maybe married, have kids. And when you start thinking about things in those time frames, maybe just like what you're planning for and how you want to raise them and all those things just kind of get brought into a different perspective or a focused perspective. And so I thought that was really, really useful. Even when you're 20, like, what does your life look like when you're 45, right? So that's like a piece of advice I would give on it. And then another one that I really like is also regret minimization. I do believe in that. It's something that Jeff Bezos from Amazon talks about, right? But when you're trying to make decisions, it's like big ones, especially, which one would you regret less having done? Or on your deathbed, which one would you wish you had actually tried, and which one you wouldn't have? And when I think about the jump into Stellar or a startup, I think that's kind of how I saw it, right? It's not that private equity wasn't great. I loved the company. I loved the team there. And, I think that investing is something that's lifelong, so you will do it. It's more that I figured that at some point, if I just stayed in that career and I looked back on my deathbed, I would be like, yeah, that was interesting, but not the greatest use of my time, and wasn't the most interesting. So kind of trying to minimize that regret by saying, I'm going to take that shot. That's actually kind of how I made that decision. And I think using that for some of the biggest decisions of your life, like if you're thinking about to get married or not to get married, right? Hard, big decision. Like which one would you regret less, right? In terms of which direction to go in, helps frame it.
Oh, no, that is just fantastic, Mike. I must say today, Will and I, that some of those tangible insights that you've got for us, that we can't wait to share them with our audience on the show. So thank you also for having us here in your wonderful offices in New York City.
Yeah, how good. Thanks, Mike.
Awesome. Thank you.